Hello, and welcome to our conversation about Parkinson's disease and Parkinson's disease dementia. There is so much important information available these days in the realm of recognizing Parkinson's disease and treatment options. We felt it was an important topic to include in our family caregiver program. Caregivers will learn so much from Dr. Vermani and his knowledge on these topics. My name is Laura Spradley, and I'm the Outreach Coordinator for the Arkansas Geriatric Education Collaborative at UAMS in the Department of Geriatrics at UAMS. Today, I'm happy to be here having a conversation with Dr. Tuhin Vermani. He's an MD, PhD. Dr. Vermani is an Associate Professor in the Department of Neurology, and he is also the Director of the Huntington's Disease Society of America's Center of Excellence at UAMS. He completed his neurology residency at Washington University in St. Louis and a movement disorders clinic research fellowship at Columbia University in New York. His research interests include gait disorders in neurodegenerative disease, specifically the phenomena of freezing of gait in Parkinson's disease. Dr. Vermani, let's get started with a very basic question. Can you tell our audience exactly what is Parkinson's disease and how it's different from Alzheimer's disease?
Sure. So Parkinson's disease after Alzheimer's disease is probably the most common neurodegenerative disorder of the brain. And what that means is that there are certain parts of the brain that lose volume or the cells die over a period of time. In Parkinson's disease, those changes result in a decrease in a chemical in the brain called dopamine, which leads to the symptoms of the disease. Whereas in Alzheimer's disease, the decrease in cells or the cell loss is primarily in a part of the brain that results in our ability to form new memories. And so while Alzheimer's disease is more of a cognitive disorder or a thinking disorder, memory disorder, Parkinson's disease usually presents itself more as a movement disorder and as a disease that affects other systems like our how we control our bowel movements and urinary function and things like that.
Thank you. Great information for them to be able to clarify the difference. What are some more specific symptoms that family members and caregivers should be aware of when they're taking care of their older adult and things to look for?
When we think about Parkinson's disease, often what we hear about is the resting tremor, where people can have a tremor when they're sitting relaxed, say watching TV. But it also affects your walking. People can walk slower, they can shuffle their feet, where their feet may not lift up off the ground as well as they once did. They don't swing their arms. It can also cause problems with dexterity, where people have difficulty with daily tasks like cutting their meat, buttoning their clothes. Parkinson's disease is more than just a movement disorder. There are also a number of features that we call non-motor features that can significantly impact quality of life. People can have constipation, problem with urination. People have problems with their sleep, so they can act out their dreams at night, and this can be particularly disabling to not only the person, but to their caregiver or partner. And so it's important for us to know about all these things, and if any of them are happening, it's important to talk to your primary care doctor about them, because we don't think that we used to attribute a lot of things to aging, and we don't do that anymore.
Mm-hmm. Okay, so my next question might be, it's kind of a loaded question. So are there any statistics or things that tell us who's more likely to get Parkinson's disease? And does it affect, of course, people want to know if it affects men or women more, and are there studies that show different ethnic groups and age groups, all those kind of things? That's a loaded question, so I apologize.
No, that is a difficult question. So currently, what we know about the disease is that it seems to affect males more than females, so almost in a ratio of 3 to 2, so 3 males to 2 females. But part of that may be that historically women may not get access to medical care as much, and so that may change. At least in the United States, it appears that the Hispanic population may have the highest incidence of Parkinson's disease, followed by non-Hispanic whites, and then Asians and African Americans. But those numbers may be different in different countries, of course, where there are different types of populations. But Europe and North America seem to have the highest number of people per percentage of the population. But since China and India are the 2 largest growing populations in the country, the number of people with Parkinson's disease in those 2 countries is really expanding as the population ages.
So this is another question. Do we know what causes Parkinson's disease?
On the level of the brain, we know that there is a particular type of cell in the brain that's in a part of the brain called the substantia nigra, and those cells slowly die over time. And those are the cells that produce dopamine, and that's what leads to the movement problems and some of the other problems that we talked about. But why some people have that happen and why others don't is still a mystery, and there's a lot of work going on to try and figure that out. There seem to be some genetic components, so that means the genes you inherit from your parents and your grandparents may have some component of leading to your risk to develop Parkinson's disease, but there are also some genes that actually may be protective. So it's kind of a mixed bag there. We do know that environment impacts how whether people get Parkinson's disease. Some of the biggest environmental risk factors are pesticides, especially the farming pesticides from maybe 30, 40, 50 years ago. Interestingly, caffeine seems to be protective for Parkinson's disease, and that's why I always have my coffee cup with me in clinic.
Okay, so coffee may be a preventative. We're covered. Okay, great. Well, thank you. That was a lot of information, but I didn't hear you say that there's one certain...
No, definitely not. It's multifactorial. A lot of people come to us and are like, am I going to give this to my family members? And truthfully, probably not. So the incidence of Parkinson's disease in the US population may be about 1 to 2%. While that doubles, it's still only 2 to 4% if you have a family member. It's not like 50% or 100% like it may be with other genetic diseases.
Good to know, so they don't worry. Yeah, okay. So let's switch gears and talk about what about if someone has Parkinson's, does their cognitive function begin to change in the disease?
Yes, it does. There's some studies that suggest that at the time of diagnosis, which is usually when people start developing the movement symptoms that we can actually see, almost maybe up to about 50% of people may have some mild impairment in their thinking, meaning they may not be exactly the way they were when they were younger. What percentage of those people go on to develop what we call dementia of Parkinson's disease is more difficult to say. Definitely exercise and healthy lifestyle can help prevent you from progressing to a stage of dementia, which basically means that now those thinking problems are affecting your daily activities.
Is there one specific test that you would do in the clinic or in your evaluation that is a definite diagnosis for Parkinson's?
Yeah, that's another good question. So we hear that a lot. We often have people come to us and tell us that my doctor did this test and diagnosed me with Parkinson's disease. Well, actually, Parkinson's disease is still a clinical diagnosis. So it's based on what we hear from our patients when we talk to them and what we see when we examine them in clinic. And there are 4 primary features that we're looking for. One is the resting tremor that I talked about earlier. One is a slowness in movement, but more specifically, slowness with a decreasing amplitude with repeated movements. So that may be manifest as people's handwriting getting smaller the more they write, for example. The third thing is muscle tone. So we see an increase in the muscle tone, so they're more stiff. And then the fourth thing is what we call postural instability, which leads to balance problems. And so you have to have the bradykinesia or the slowness and one of the other 3 to make a clinical diagnosis of Parkinson's. We do have a test now that can tell us whether there is a deficiency of dopamine in the brain, but that doesn't mean that you have Parkinson's disease. There are many different causes of a dopamine deficiency state, but it does help us in the right context to say that more likely than not this is Parkinsonism or Parkinson's disease.
So one more thing to the equation to help you
Right.
Yeah, but no one certain blood test that says.
Diagnostic test yet.
Yeah, well, good information. Again, wealth of information. So what are the medical treatments or therapies that you recommend to people once you tell them that they have Parkinson's?
So the treatment is very specific to each person. So early on in the disease, when symptoms are mild, just because you have a diagnosis of Parkinson's disease doesn't mean you may even need to be treated. Most of the treatments we have treat the symptoms of the disease. They don't necessarily change the course. So if the symptoms are not affecting your quality of life, you may not need to be treated. if the symptoms are impacting your quality of life, on the other hand, there's no reason not to be treated. We hear a lot of stories about people reading on Dr. Google that these medications may cause problems over time, and that's really not true. The medications help treat people very well. We can help people have a very good quality of life for decades, and so it is important to get with the right team to help you along those stages and keep you as active and keep you as functional as possible.
Absolutely. Quality of life, it's huge. I
Most
hear all of
important
you
thing. Yeah.
physicians talking about that. It's important to have that quality of life.
Right.
Okay. Well, thank you, Dr. Bermani. This has been wonderful.
Thank you.
This information has been brought to you by a grant from the Health Resources and Services Administration. Check out more clips on dementia and caregiving at agec.uams.edu.